Welcome to our clinical skills video. As a dental hygienist, you have the invaluable opportunity to improve the lives and health of the patients you meet while representing TempStars, and we're happy to have you with us. Today I'll share some pointers that can help enhance efficiency, effectiveness, and patient comfort in your clinical care, helping you to be a well-reviewed, well-paid professional who's requested again and again. We thank you for helping to put patients at ease by demonstrating TempStars' standard of excellence. It's always good to greet your patient with a warm smile and maintain a professional appearance. This means clean, well-ironed scrubs, avoiding overly tight or sloppy uniforms. Since we sit so close with our patients, it's wise to avoid strong smells since many patients have allergies. For the appointment time, please give your patient your focused attention. Be sure to wear your PPE properly and follow infection control protocols. Patients are watching closely to see if we've washed our hands or if we touch surfaces before examining them. Greet your patient warmly and escort them to the treatment room and help them get comfortable while maintaining a professional focus on their care. As healthcare providers who spend significant time with patients, we have both the privilege and responsibility to screen for, prevent, and treat conditions that could lead to serious health issues like diabetes, cardiovascular disease, cancer, and pregnancy complications. For medical history updates, go beyond simply asking, "Any changes to your medical health?" Many patients just don't respond to that question thoroughly. Try asking specific questions like, "I have your medications listed as," "Is this still accurate?" "I have your diagnoses listed as," "Have there been any new diagnoses since your last visit?" You can screen for sleep apnea by asking about their sleep patterns and evaluate their airway and breathing when reviewing medical history. I recommend taking notes immediately so that you don't forget any important details. Complete your extra and intraoral cancer screenings thoroughly. This crucial step should never be skipped as it literally saves lives. If it's the office's standard, take their blood pressure. Next up, you'll be taking their radiographs, and be sure to ensure quality images the first time. If you get cone cut or overlap, just go ahead and retake it now. This will prevent delays during the doctor's exams. Some offices may request intraoral photos or 3D scans as part of their comprehensive care approach. Next up, you'll have your patient complete their pre-procedural rinse. Now is your chance to really show the patient how much you care. You can enhance their comfort by offering sunglasses, neck support, lip moisturizer, and topical anesthetic as needed. Next, you'll ask about their specific concerns like sensitivity, malodor, or inflammation. Next up, periodontal charting. This step is non-negotiable. We cannot accurately treat our patients without knowing their probing depths. Discuss with the doctor at the beginning of the day how they prefer to handle different clinical findings. After completing your assessment, explain your findings to your patient in respectful and understandable language without causing embarrassment. You'll need to adapt to each office's charting system while ensuring thorough screening for every patient. Before starting treatment, establish clear communication signals with your patient if they experience discomfort. I just tell them they can raise their left hand if they need me to adjust anything. For efficiency, consider polishing first, then using ultrasonic scaling for the entire mouth, followed by hand instrumentation. As you're working, watch for signs of discomfort in body language and adjust your technique accordingly. We all run into difficult patients, especially those with a strong gag reflex. In that case, you can offer them the suction for them to hold so they feel more in control. You may even put their chair more upright and save the posterior lingual surfaces for last, as those aerosols can really initiate their gag reflex. Many nervous patients like that we tell them step by step what we're going to do next. Ensure comprehensive scaling of every tooth every time. Even if with just a light exploratory stroke, make sure the patient has a thorough cleaning, followed by polishing, flossing, and rinsing. Please use a light spray of air and make sure that you've removed everything. And if for some reason you couldn't, just be sure to let the doctor know before they start their exam. When providing oral hygiene instructions, demonstrate techniques and have the patient practice while you observe. If you have a shorter appointment time, you may consolidate some steps, like maybe you do your oral hygiene instructions while you're doing their flossing. Just be careful that the patient doesn't feel rushed. You can demonstrate your value both to patients and the practice when you recommend appropriate products and service that align with the office's offerings. Inquire at the beginning of the day if they would like you to recommend specific home care tools or products. Be careful to only suggest treatments available at that office and within our scope of practice as dental hygienists. If and when you encounter any concerns or issues, communicate discreetly with the doctor about it without alarming the patient. When discussing questionable dental work, you can frame it in a way where it doesn't sound like you're accusing anyone of doing a bad job. You might say something like this: "Doc, I wanted to see if you could check the margin of tooth number 14. I noticed some inflammation and I wanted your help finding the cause." Remember, you're representing that office for the day. Focus on providing excellent care and ensuring patient comfort. During the doctor's exam, share relevant findings concisely and then allow them the time to connect with their patient. Use this time to complete your clinical notes and be ready to assist if the doctor needs you. When recording your notes, please avoid abbreviation and use the office's templates when available. Include key details on screenings, instructions, and diagnoses. After completing treatment, thank the patient, provide them their home care supplies, and escort them to the front desk. Clean the room following proper infection control protocols and manage instruments according to the office's instructions. If you're running behind, it happens to the best of us, just communicate with the team. They may let you know if there's something you're doing in the appointment time that another person can handle to help you manage your time. In between patients, it's wise to take brief moments for self-care. Taking a deep breath, stretching, or saying a positive affirmation helps to maintain your well-being. If you encounter a difficult patient, try not to take it to heart, remembering that their behavior often reflects on their own challenges rather than your quality of care. During cancellations or downtime, proactively offer assistance with tasks like stocking the room or helping with sterilization. A word of caution though, always return items to their original location so they can easily locate it the next day. Please avoid cell phone use during working hours and focus on providing support to patients and the team. If you're not sure what you can do to help, just ask. After your shift, use the TempStars app to send your invoice and rate the office on friendliness, infection control, equipment quality, and preparedness. The office will rate you on the following categories: clinical skills, professionalism, communication, and time management. Higher ratings increase your earning potential and booking opportunities, while consistently low ratings may result in removal from the platform. To help maintain your enthusiasm for your profession and elevate your clinical care, it's recommended to regularly engage in quality continuing education courses. It's helped me so much in my career personally. We want to thank you for your commitment to excellence as a dental hygienist. TempStars is proud to support your professional growth and development, and we look forward to our continued partnership.